So Brittney, Ozzy talked before about how when her vet initially told her all these things, she got nothing. She didn't understand, she wasn't really hearing what the vet was saying. It took her a while to assimilate. So Dr. MacPete gives that whole amazing talk, pathophysiology of diabetes and exactly what's going to happen, and then goes on to the next case, and you're left now with the client, and the client says to you, what did she say? So what conversation do you have with the client?
So I guess when I'm approaching a new diabetic patient's owner, the first thing that I always tell them is very similar to what Dr. MacPete said, is that they're not alone, and they have an entire support.
You're not alone, by the way.
I'm
right?
definitely not alone. That they have an entire support system behind them. So we're just often a phone call away, and don't be afraid to give us a call. That's why we're here, for any questions and any concerns. I also like to let them know that they already have a lot of the tools, like tools that they need at home to successfully monitor and administer the insulin, as well as the tools that we're going to provide them. So one of my, I'm sorry, one of my most important jobs is to make sure that they feel comfortable and confident when they go home in, you know, getting the blood glucose samples, testing those samples, and administering the insulin. Right. So then they say to you, do I really have to do it? And I say yes.
Okay. So how do I do it? I've never given an injection. I don't know. It's scary.
It is scary.
How do you manage that?
So it often starts with a stuffed animal that we bring into the room with an insulin needle of saline, and we show them. First, I'll show them how I administer insulin.
By the way, do you do it differently in dogs or cats, or is it pretty much the same?
It's very similar. It's a subcutaneous injection. I'll tell them the most common spots where I recommend administering the insulin, just based on ease. Often we discuss the tenting mechanism, where you pull up the skin and you look for the tent for easy application of the syringe. And then I show them, and then I sit with them as they practice.
And then when you say them, you know, one of the things that's happened to me before is, you know, the husband picks up the cat, and then the wife is the one giving insulin.
Yes.
So how do we make sure that, I mean, we need to make sure that's not going to happen.
I do. So it's very important that I'm saying who will be administering the insulin. And if you're not sure, I want to make a time where both the husband and the wife can make it, so we can show them, navigate through it, and discuss it and answer any questions that they have. And often, Dr. MacPete talked before about how often the pet will be hospitalized for maybe a day, so you kind of have time to go through this. It doesn't have to be all in one quick 10-minute session. It isn't, and it's in a process. And I often tell my pet parents, go home, think about it, you know, take some time, absorb it, process it, and ask me any questions that you have. I'm here to help. But you don't set them loose until you've seen them handle the insulin, right? Which is also interesting, right? Absolutely. This is not like orange juice that you shake it and... Please do not shake the insulin bottle, as I'm sure you know. Yeah, so there's obviously techniques that have to be appropriately handled to handle the insulin. Often a slight rolling mechanism or a slight invertation of the tube. I show them the appropriate insulin syringes to use, how to go about successfully pulling up that insulin, and before they leave, I always make sure that I see them handle the insulin bottle, you know, pull up the insulin, and make sure that it's at the right units. So stuffed animal. Stuffed animal. When do they actually practice on spider? When they are comfortable with the stuffed animal, and then we'll move on and we can actually practice on their own pet when they feel like they're ready to take that step. We don't start with insulin, we start with usually saline, but we'll work our way there. And once they feel comfortable, I'll even have them bring in their vial of insulin, show me how they pull up the insulin, and stand with them while they're administering it to their pet. That's a really important point, because people sometimes, they forget their insulin, they drop their insulin, they leave it in their car, they go to the pharmacy, they get a different insulin, and we think they're giving one thing, they actually are giving something else, they have the wrong syringe. So you actually look at that when they come in for their recheck? Absolutely. So every time they're coming in for the recheck, I ask them, please bring in the insulin that you're using and the insulin syringes that you're using to administer the insulin, to make sure that they are compatible and they're the correct insulin syringes. Wonderful. And bottom line, as nervous as people are initially, what would they say typically, and we're going to ask Ozzy in a second, but what would they say typically, 2 or 3 weeks later? They say, I'm still nervous, but I feel better about it. And each day, they do it, and they actually do it, and each day gets a little bit easier. Yeah, I think, to me, the first thing is, don't euthanize your pet. People often will say, I can't do it, I just can't do it, I'm sorry, I need to give up my pet. Obviously, Spider was given up, right? Maybe because he was urinating in the house, maybe because they couldn't handle, the diabetes. Yep.
we'll figure out a way to make this work for you. And at the end of the day, and then they all do it. They all do it, no matter how squeamish they first started out.
And I don't care how many times you have to call me, how many times you need to come in to go over it one more time. That's what we're here for.
And they become pros not only at giving insulin, but home monitoring.
And then they often give me advice and techniques on how to successfully administer medications.